Well, thank you all for coming today. I'm Ruth, I'm from HIM. So we are the ones that call you and say you have a wonderful death certificate to complete for us and walk you through that process. Teresa's the one that does the majority of that work back there, so she would be the one that would give you a call or a Doc Halo message. But we invited Dr. Stark here today to come and talk to us from the Kent County Medical Examiner. He did bring 2 assistants with him, so he is going to keep us on track and answer any questions you might have. Anything, when to call, when to report, he's going to review that with us, and we thank you, Dr. Stark, and your staff for coming.
You're welcome. Thank you. So hopefully we can keep this very informal. Interrupt me along the way if there are questions that come up, and then we'll have plenty of time for questions. This will be relatively brief. So I'm a forensic pathologist and Deputy Chief Medical Examiner for Kent County, and then Chief Medical Examiner for Ottawa County. Many of you may not be aware, but we do the medical examiner cases over at Blodgett, and that's been the case since I've been here for 20 years, and Steve Cole is my partner, and he's been there for 34 years. So the 2 of us are the ones that get involved in performing the autopsies on medical examiner cases, and it's at Blodgett, and then we also have roles as medical examiners for Kent and Ottawa County. And that may involve not so much doing autopsies, but overseeing the system and certifying the death certificates. So first, let's before we get into the medical examiner type issues, let's just do general issues related to the death certificate. So the purpose of the death certificate is, a big part of the purpose of the death certificate is for public health statistics. And the second part of it is for the insurance companies and the next of kin to get benefits, and then just have an accurate representation of what actually caused the death. So if you kind of keep that in mind, that the big picture is really health statistics and the insurance company and benefits, and what they're really interested in and what we see most frequently as far as inaccuracies in the death certificates is non-specific terminology. So things like respiratory failure, renal failure, cardiac arrest, those type of terms don't need to be used at all on a death certificate. If you do want to use those terms, that's okay, but you just have to make sure that underneath that line there's a more specific disease process. So for instance, if you have someone that goes into respiratory failure but their underlying disease is COPD, then make sure that COPD is on there. And it's perfectly appropriate to just list the major underlying disease. And I know for a lot of the deaths, it's multifactorial. These folks have hypertension, COPD, coronary artery disease, what have you. And so do your best to try to ferret out what the most significant disease process that actually led to their death. And list that as the primary cause of death on one. And I've got copies of, everybody has copies of the death certificate. It's one of my printed copies, so you see my name on there and number is just because obviously back in the day of paper death certificates, I had to use quite a few of them, so they printed up for, but so of course it wouldn't have my name on it, it'd have your name on it, but under 1A, where it lists the primary cause of death. And then there's a part 2 where you can list any significant conditions that contributed to the death. So you don't need to list it. The death certificate's not like a discharge summary where you want to list all the diagnoses, and so everything gets coded. The death certificate, that's not the purpose of it. The purpose is to list the major diagnoses that attributed to the death. So that's the other issue we run into not infrequently, is that people may tend to list just about everything, thinking it's more like a discharge summary. So do your best to try to hone down what the major disease process is that actually underlying cause of death. List that under part 1. If there are other significant conditions such as diabetes, hypertension, COPD, what have you, you can list that under part 2. And one other thing that I will mention as far as, and I know the HIM folks are probably clued into this pretty well, but actual time of death and time pronounced death. In the hospital setting, it's really most convenient and probably most accurate just to list the time pronounced as well as the same as the time of death, even though nursing may say, oh, this person died, and they call the resident up, and the resident comes 20 minutes later. Just make it the time pronounced for the time of death. It just makes it a lot cleaner for all the paperwork, that the insurance companies and all the rest of it, if the time of death and the time pronounced is the same, especially when it's in a hospital setting. The reason they have different boxes for that is because mainly for medical examiner cases where we may go out and pronounce someone dead one day, but they clearly died a day or several hours earlier. So that's why they have that separate box. But in the hospital setting, for the most part, if it's just a difference of minutes, then I would list time pronounced as time of death the same. And then when you're thinking about the death and doing the death certificate, the other issue we have are relatively non-specific terms such as intracranial hemorrhage, intracerebral hemorrhage, and then if the county reviews the death certificate when it gets filed, and if the county clerk sees something like hemorrhage or fracture or injury, then they think that it could be potential medical examiner case. So for instance, if you have someone who has an intracerebral hemorrhage, hypertensive type intracerebral hemorrhage, then you can just put on there intracerebral hemorrhage, hypertensive type, or even better, just say parentheses non-traumatic. Then when it goes to the clerks, even though they see that word hemorrhage and they think, oh, that means bleeding, and maybe a medical examiner needs to be involved, they say non-traumatic, and it'll go right through. And then probably one of the issues with death certification that we run into where cases should be reported to the medical examiner but aren't are delayed deaths. So someone comes in with a hip fracture or a subdural hematoma from a fall, and they die days later, and they die of pneumonia or respiratory failure, but what really initiated the chain of events is some sort of trauma. So just remember on those delayed deaths that the medical examiner then needs to be called. So when we move away from the death certificate, we move into what type of cases the medical examiner needs to be called on. Anything that's not exclusively due to natural disease. So if you've got somebody that, a hip fracture, an elderly patient, that may not actually be the primary cause of death. It may be that they had an MI or perhaps aspirated or pneumonia or something of that nature, but it's a significant contributing factor to their death because it debilitated them. Then those type of cases we like to get referred in for certification, because generally we'll accept those type cases if there's a major injury, subdural, neck fracture, hip fracture, something of that nature, then we'll go ahead and accept it and certify the death. And generally, if those are significant contributing conditions, we'll make those accidental deaths. We don't need to autopsy those individuals, but we'll make them accidental deaths. And sometimes you get the question, well, okay, they've got the hip fracture, but they got all this other natural disease. It can be somewhat of a judgment. If the person is so ill that the fracture really didn't contribute to the death significantly, then certainly if it's in your judgment that it's purely due to natural disease, then you can sign the death certificate but leave the fracture off. So occasionally we'll get people that'll come in and they might have a fractured wrist or maybe nothing as major as a fractured hip. They had a fall, they may have a fracture, but really they're in such poor medical health and they've got such significant diseases that the fracture or the fall is not a significant contributing factor. And if that's the case, then it's fine, certify them as natural, but don't list the fracture on the death certificate, because if you list the fracture on the death certificate, then the county clerk's going to see fracture and it's going to prompt a call to the medical examiner to investigate. So as far as I'm trying to think if there's anything else on the death certificate itself. There's a couple of, again, the main use of this is public health. So you'll see there's a box for did tobacco use contribute to death? Obviously, in your medical opinion, if a tobacco use contributed, then check yes. If you're unsure, you can always put probably. If you think it did, but you're not sure, you can put probably. If you don't know, you can just check unknown, and that's fine. But they try to keep public health statistics. And then the female box about pregnancy, that's, again, a public health surveillance type box. And most of the time that's not going to come up, but if you do have someone was pregnant within the past year, then they want that noted. And then, of course, the manner of death. And again, in the state of Michigan, like most states, anything that's not exclusively natural disease is referred to the medical examiner for our certification. And it's not so much that we're going to need to autopsy individuals, because most of the time when they die in the hospital, their incident is well documented, whether it's a motor vehicle crash or a fall. And if there aren't anything suspicious about that, then we won't need to autopsy them. But for the certification purposes, we'll accept it and we'll need to fill out the bottom part. And that's just to make sure that those statistics are generally the medical examiner's office is going to have more staff and ability to fill in that information than an attending physician or a resident at 3 o'clock in the morning, where they have to try to figure out date and time of the injury, where the injury occurred, how the injury occurred. So that's why all the non-naturals get reported to the medical examiner, even though we may not autopsy very many of those when they die in the hospital. As I'm sure you guys are aware, we certainly are, is the big bump in our drug overdoses. Whether it's prescription drugs or now illicit drugs. And certainly a number of these folks are going to get resuscitated but die of hypoxic encephalopathy days later. Those cases should be reported to us because, again, even though we may not order the autopsy, if the initiating event was some sort of a drug overdose, then we'll have to accept it. And one thing that you might keep in mind, and I know this is really hard to remember at the time, is that usually what happens in the emergency room right when they're admitted, they'll get just screens done on the blood or the urine, and they won't actually quantitate drugs that are identified. For our purposes, we like to see quantitation because it gives us a little bit more information, a higher degree of certainty when we certify a death is due to a drug overdose if we see a high level of either morphine from heroin or cocaine or oxycodone or what it is. So even though that level won't affect any treatment that may occur, because that's based on the clinical scenario, and so that's often why you don't get the levels. If you can call, if you have a patient that's a potential drug overdose and it looks like they may not make it, if you can call the lab and have samples saved, then what we'll do is we'll call for admission samples. They send them over to our tox lab and we run levels on those just so we can see how high they are, because potentially some of these drug overdose cases can go to court if they're able to find the drug dealer, the person that provided the drugs. Any questions at all pertaining to the death certificate itself?
The intervals between.
Oh, yes. Oh, yes. I'm sorry. So in addition to writing down the cause of death, then there'll be an interval. And you'll see on the side it says approximate interval between onset and death. So that can be relatively broad. So you can put something like days, hours, years. If for the most part what we try to do with the death certificate is list the main underlying disease. So for instance, chronic obstructive pulmonary disease, coronary artery disease, hypertension, most of those are going to be years. The person's had it for years. So think about the underlying disease and how long that's been present, not so much, well, the respiratory failure was just for a few hours, but their COPD was years. So when you fill that out, try to think of the duration of the underlying disease that caused the death. And that's something that has to be filled out as well. Manner of deaths, again, for non-medical examiner cases, those are always going to be natural. And I think the rest of the information, the top part of the death certificate is all demographic information that the funeral home fills in. So you don't have to worry at all about the top part. It's all just this middle part where it says starts with certifier, and then it lists, and then of course the cause of death there.